사회적 책임들을 달성하기 위한 자발적인 활동들을 좀 많이 해왔다고 생각을 하고요. 또 하나는 보편적으로 인류의 건강과 삶의 질을 개선시키기 위한 노력들, 이런 역할들에 대해서 균형 잡힌 노력들을 계속해왔다고 생각을 합니다. 덧붙여 우리 직원들이 모두 행복해하고 모든 사람들이 와서 일하고 싶어하는 존경받는 그런 기업이 돼 나갈 수 있을 걸로 생각을 합니다.
Good afternoon, everyone. Welcome to Makati Medical Center Obstetrics and Gynecology Lay Forum entitled Take Charge of Your Vaginal Discharge. May we call on Dr. Carla Victoria Espina Castro, our moderator, to start this Lay Forum. Good afternoon, Dr. Carla.
Hi. Hello and good afternoon, everyone, our dear doctors, colleagues, and our dear patients. Thank you for being with us this afternoon. Again, we'd like to welcome you to our last lay forum for the year, aptly entitled Take Charge of Your Vaginal Discharge. Okay, next slide. So just a few house rules so that we'll have a quiet and interesting afternoon. Please mute your microphones and be mindful of background noise. Please disable your videos. Place questions in the chat box. We will be answering your questions after all the speakers have given their lectures. Thank you. So may we call on Dr. Mikey Comendador to give us our opening prayer.
In the name of the Father, the Son, the Holy Spirit. As we gather here in the harbor of your safety, we thank you for fellowship and family. We ask that you will strengthen us, restore us, and inspire us with your love. Lord, fill us with your peace so that as we journeyed onwards, we would pour out your love and grace to others. We ask that our souls would catch the wind of your spirit so that we would take your promises to all the earth. Amen. In the name of the Father, the Son, and the Holy Spirit. Amen.
Thank you very much, Dr. Comendador. Now, to give us the opening remarks, we'd like to call on the Department of OBGYN's Vice Chair for Quality, Dr. Romeo Mendoza.
Yeah, thank you, Carla. Can you hear me?
Yes, doctor.
Yeah, thank you. Good afternoon. In behalf of the Makati Medical Center Department of OBGYN, we welcome everybody. We welcome you to our regular lay forum. Today's lay forum, as was said, aptly and appropriately tied to the topic for our patients. No? Take charge of your vaginal discharge. So I'm sure everybody will be informed and enlightened of today's topic. Again, we welcome everybody. Thank you very much. Good afternoon.
Thank you, Dr. Mendoza. Okay, so we'd like you to meet the team that brought about this afternoon's lay forum. So we have three excellent speakers to be discussing different topics. So we have Doctors Cristina Maladeo Miravalles, Doctors Anafe Orbigoso Gloria, and Dr. Patricia Florestinco, and yours truly as the moderator for this afternoon. And also helping us with the technical stuff, our very reliable and efficient residents, Dr. Maureen Manzana, our Chief Resident, Dr. Mikey Comendador, and Dr. Angel Estela. Okay, so these are the several topics that will be discussed this afternoon. Anatomy of the female reproductive tract, the normal vaginal discharge, abnormal vaginal discharge, when to see your doctor, what to expect when seeing your doctor, and the recommended treatment for vaginal discharge. So to kick off this afternoon's lecture, may we call on Dr. Cristina Meledeo Miravalles to talk to us about anatomy of the female reproductive tract.
Thank you, Dr. Carla Castro. I promise to make this short and sweet because the meat of the lecture is will be given by the two succeeding speakers. No, so it is important to know the anatomy of the external female genitalia, or in short, the vulva. Can I have the next slide? So that's it. Mikey, please help me in pointing the structures. No, it's important to know the vulvar anatomy because some patients of mine are afraid or scared of checking their own anatomy. So some of them even don't know where the urine comes out, no? So they thought or mistaken that the urethra is the same thing as the vagina. So let's start, no? So here's the photo of the external female genitalia. You would notice that there are three obvious openings. We have the urethra up there, and then the middle is the vagina, vaginal opening, and the last is the anus or anal opening. Okay, so it's important to take note of this so that when you clean your vulva, you should start with the front and last would be the back part so that the bacteria from the anus won't go to your vagina and urethra. There are other openings like the skin glands, lateral or beside your urethra, and Bartholin's glands, lateral around 5 or 7 o'clock from your vaginal opening. But for this lecture, it's enough for us to know the three major vulvar openings, no? The urethra, the vagina, and the anus. Other structures in the vulva would be the clitoris, the labia minora, and the majora. Now we go to the next slide. This photo is actually the one I'm showing to my patients in the clinic so that they would have a better visualization of what they actually have. We had discussed already the photo on the lower right, which is the vulva. So it's nice to know that your vagina is not just a hole or opening, but it's actually a canal. Can you point this one? This is the vaginal canal. It's actually around 7 to 8 centimeters long, and it's connected to the cervix. The cervix is the lowermost part of your uterus. These two structures, the cervix and the vagina, are the ones giving off the vaginal discharge. So it's a mixture of cervical discharge, vaginal cell secretions, bacteria, mucus, etc. So the vaginal discharge may be different from time to time in a person or even in other persons, especially in the reproductive age group. So let's focus on the lower left later, no? Okay, for the next slide. So this is the components of normal vaginal discharge. You have the color. It's usually clear or whitish fluid that comes out of your vagina, and it can be watery and sticky to gooey, thick, and pasty. The smell, it might have an odor, but it shouldn't be strong and shouldn't be unpleasant. It is about 1 to 4 milliliters of fluid per 24 hours. But some people may produce lots of vaginal discharge, others produce less. Certain factors like pregnancy, using of the birth control pills, or ovulation, and even menopause can affect how much vaginal discharge you will have. Usually the normal pH is around 4 to 4.5, so this is acidic. Okay, next. So the uterus, the cervix, and vagina produce the vaginal discharge, which is mainly made up of cells, bacteria, mucus, and fluid, which I have told you earlier. So the purpose of this vaginal discharge, so it's normal for us to have vaginal discharge, no? So the purpose of this is that it helps clean and lubricate your vagina and helps fight off bad bacteria and infection. So the discharge from the vagina is a natural and normal process, because I've read in the pre-lecture question, is it normal to have vaginal discharge? Yes, it is normal. However, changes to your discharge can be a sign of infection or disease. Okay. What makes a normal vaginal discharge acidic? So you have the cells, no? You know naman the cells from the vagina. Okay, the cells of the vagina is rich in glycogen or sugar. So the glycogen is a substrate or food of the lactobacilli, the good bacteria inside the vagina. This lactobacilli then will convert the sugar into lactic acid. And this increase in lactic acid creates an acidic vaginal environment, which is the pH of 4 to 4.5. Why do they do that? This acidity helps maintain the normal vaginal flora and inhibits the growth of pathogenic organisms. Okay, so next slide. So I want to show you this is a reproductive age woman, no? This is the endometrium, or the lining of your uterus. As you can see, Mikey, can you point it? As you can see, the first week in the picture, it's sloughing off, no? So it's menstruating. So during menstruation, you have the discharge is blood, bleeding, and this is the start of follicle recruitment. So at the upper portion of your photo is the one of the follicles. So our follicles are actually 300 to 400,000 in our ovaries. So when we are in menopause already, we don't have follicles anymore. It's being used up already. So that's a part of the menstruation. Just right after menstruation, so we have a thinned out endometrium. Can you show, Mikey, where it is? This part, no? This is just right after menstruation. We don't usually, the reproductive age woman don't usually have discharge. They feel dry, but estrogen starts to build up. Where this estrogen comes from? It comes from your developing follicle. So can you just point where the developing follicle is? So this one, no? They're producing estrogen. So the estrogen is the one that helps build up your lining. So slowly, as you can see, as Dr. Comendador points it, the endometrium starts to rise up or thicken. Okay? So days before ovulation, your discharge turns to sticky, whitey, and creamy because estrogen is beginning to peak. And you're going to have a mature follicle. Can you show the mature follicle? That one, it's about to rupture, no? And to release the egg, about to release the egg or the ovum. So at its peak, the estrogen now will make your discharge clear, wet, slippery, and stretchy. It's just like an egg white consistency. So the main hormone for this part is the estrogen. So the mature follicle ruptures and releases the egg. Right after ovulation, the discharge will now turn into sticky, dry, color white. This is brought about by the progesterone. Because when the follicle ruptures, the follicle now changes its name to corpus luteum. No, this is the corpus luteum, and it will now release the hormone progesterone. So the progesterone actually helps maintain the thickening of your endometrium. It makes your endometrium more glandular. So you can see the changes. It's just like curled up, no? Kulot. So actually it will help if there's any fertilized egg, it helps maintain the pregnancy. The progesterone helps to maintain the pregnancy, no? However, if there's no pregnancy, the corpus luteum will die soon in 2 weeks' time, and you won't have any progesterone anymore. So the effect will be if you don't have progesterone anymore, that's the time that you're gonna repeat your menstruation or menstrual bleeding. This is for the reproductive age women who have regular cycle. Now we go to other status of the women. Can you go to the next slide? So during pregnancy, it's normal to have whitish discharge. Sometimes it's more than you usually have, and we call this leukorrhea of pregnancy. As long as it's not itchy, it's just fine. During breastfeeding, progesterone predominates. Usually, the patient feels dry. How about during the time that the patient uses oral contraceptives? There will be minimal menstrual bleeding because of the oral contraception, and the patient might feel a little bit dry also. During menopause, we don't have the hormones, estrogen and progesterone, so it's really very, very dry. And it's just the same as the pre-adolescent prior to the menstruation. There's no discharge. I think this is the end of my lecture. Back to you, Dr. Castro.
Thank you, Dr. Miravalles, for that interesting overview on female anatomy and normal vaginal discharge. Now we'd like to call on our next speaker to discuss to us about abnormal vaginal discharge, Dr. Anafe Orbigoso Gloria.
Hi, thank you so much, Carla. And thank you so much for the very comprehensive introduction about anatomy and the normal vaginal discharge. Now, let me walk you through what is abnormal in your vaginal discharge. Next slide, please. Okay. In describing your vaginal discharge, you have to take note of the following. First, what is the color of that vaginal discharge? What is the odor or the smell of that vaginal discharge? We have to take note of the consistency of that vaginal discharge and if there is any other associated symptoms that goes with your vaginal discharge, as well as the timing or the occurrence in relation to the menstrual cycle, or depending on your status, if you're pregnant, menopause, premenopause, or in the adolescence, or in your mid-year in life. Next slide, please. If you have a bad smelling vaginal discharge, which becomes even stronger after sexual intercourse, then definitely that is abnormal. Next slide, please. If you get the feeling of always being wet and the vaginal discharge is malodorous, and sometimes you could see in your underwear that it is even yellowish and bubbly, and also if it is associated with some difficulty in urination or some pain and with some itchiness in the vagina, then definitely these are signs that your vaginal discharge is not normal. Also, if you notice that your vaginal discharge has this appearance of being cottage cheese and associated with intense vaginal itchiness, especially occurring more often before your menstruation, with associated pain in urination and even pain during sexual intercourse, then definitely it's also abnormal. Next slide, please. The presence of pus-like vaginal discharge, or what we call mucopurulent vaginal discharge, as you can see in this photo, also denotes an abnormal vaginal discharge. Next slide. When there is blood in your vaginal discharge and you're not having your menstruation, when there is blood during sexual intercourse or even after sexual intercourse, and when you have any form of bleeding but you are already menopause, then definitely your vaginal discharge is abnormal. Next slide. In summary, next slide, please. Mikey, in summary ng vaginal discharge ko. Okay, so in summary, if your vaginal discharge is malodorous, it's associated with itchiness, pain, and it's occurring after the menopause, then definitely it's abnormal. So you have to take note if your vaginal discharge also has this very strong smell and becoming more intense after sexual intercourse. So when all this happens to you, you have to seek the consult of your gynecologist. So there it goes. If there's itching of the vulva, the vaginal opening, or the labia, if there is redness, burning, soreness, or swelling of the vulvar skin or the outside of your vagina, the presence of foamy or bubbly or greenish vaginal discharge. Again, if there's bad odor, no, fish-like smell, and it is blood tinged and with associated pain during intercourse or urination, and there's abdominal pain or pain in your lower abdomen, then these are all signs that you have abnormal vaginal discharge, and you have to seek consult with your gynecologist. Next slide, please. So how do we maintain healthy hygiene? Okay, abnormal vaginal discharge may more likely to develop in women who practice certain habits like the following. Someone who douches daily, who uses panty liners daily as well, the use of feminine hygienes, what they call sprays, powders, or rinses, the bubble baths or other scented bath products, and those who uses tight or restrictive synthetic clothing like thongs or your synthetic underwear. Okay, so healthier practices would include the following. Let's take note of this. You have to use water or your unscented, non-soap cleanser to wash the genitalia. Use warm, not hot, and you use your hand, not the washcloth. But of course, you have to be sure that your hands are also clean before you touch your genitalia. Avoid douching or the use of too much feminine hygiene products. If there is odor or discharge is bothersome, you have to see a healthcare provider. You have to avoid hot baths with scented products. You have to use only plain warm water. And of course, we have to wear cotton underwear. Unfortunately, you have to avoid your thongs and your lycra underwear. You have to rinse your genitals with water and only pat it dry. Don't rub, and it's always from the front going to the back when you pat it dry. And avoid the use of baby wipes or scented toilet paper. Next slide. Okay, thank you. And back to you, Carla.
Thank you, Dr. Gloria, for that very extensive lecture on the different abnormal vaginal discharges. Okay, so now for the last lecture for this Slay Forum, we'd like to call on Dr. Patricia Ko to discuss to us what to expect when you see your gynecologist.
Thank you, Dr. Castro. So thanks also for this very interesting lay forum. This is really rare to have a forum about vaginitis, about feminine hygiene, also talk about the vagina. But I think this is very important because there's a lot of misinformation, it's taboo. So it's good to talk from experts and to know what is the latest evidence. So if you have any unusual vaginal discharge, or you just want to have your routine checkup with your gynecologist, but you are afraid, so this is a talk in order to allay your fears and to walk you through what you should expect when you see your gynecologist. Next slide. First of all, when you do your checkup with your gynecologist, she or he will do a history taking. So your gyne will ask about the first day of your last menstrual period. So that's very important. Please take note. Remember, when was the first day of your last menstrual period? How is your menstruation? Is it regular or irregular? How many children have you had, if ever you had children? Do you use any contraceptives? Do you have sexual contact? Do you use a condom? And then your gynecologist will also ask about your sexual history. So all of this will be asked in a non-judgmental manner, and all the information will be strictly confidential. So please be very honest with your gynecologist, because the information that you will provide will also be valuable in helping the gynecologist in making a good diagnosis and also a treatment plan. So please be honest and don't be afraid of saying intimate details to your gynecologist. Next slide, please. After the history and the after the history, which will also include family history, for example, history of cancer, also a history of any past medical illnesses, your gynecologist will have to do a physical examination. So before doing a physical examination, it's better if your bladder is empty. So urinate first before having this consultation. And then you will be asked to lie down on the examining bed. So usually the examining bed of the gynecologist has stirrups, no? Most of the time, there are stirrups where you have to raise up your legs. So this is comfortable. Try not to be too tense. And the gynecologist will shine a light on the external genitalia. This is in order to see if there are any abnormal lesions, masses, or ulcers in the external genitalia. After which, your gynecologist will, with sterile gloved hands, will gently insert a lubricated speculum inside the vagina. So a speculum is like a duct-like instrument. It's like a duck bill that will be properly lubricated and will be inserted gently inside the vagina in order to see the cervix. The cervix is it's like a ring-like or a donut-like shaped organ that is at the end of the vagina. Because most of the time, infections or cancers can arise from this area. So it's important to see this area, the inner part of the vagina and the cervix, because you cannot see your most intimate parts, no? So it's important for the gynecologist to see that. The gynecologist will look if there are any masses or lesions, and then will also check if there are any abnormal discharges. Now, your gynecologist may have to do a pap smear. So the pap smear, can you go back to the previous slide? The pap smear is an examination where cervical cancer or precancer of the cervix will be detected. Also, it is also very important now to do a high-risk HPV DNA test, which is now even more sensitive than the pap smear in detecting women who are at high risk of getting cervical cancer in the future. If your gynecologist is suspecting that you may have an infection, other laboratory tests may have to be done, such as wet mount, gram stain of the vagina, or other tests like gonorrhea and chlamydia testing. So this will depend on what your gyne will see during the examination. So all these tests will be done at the same time. So you don't have to repeat, lying down and having a speculum done. And your gynecologist will use a soft brush or a cotton bud to do some tests. After which, your gyne will gently remove the speculum and may have to do an internal examination, or what we call an IE. So she or he will insert a gloved finger inside the vagina in order to feel for the uterus and the ovaries to see if there are any unusual masses. So all these tests will only last for 5 minutes or less, and it's not painful. So try to relax, just do slow, deep breathing and try not to resist so that it will not be painful. After this examination, it can be normal also to have just a little bit of bleeding, so don't be afraid. So that's normal. Next slide, please. Okay, so as I mentioned, you may have to have a pap smear, also a high-risk HPV DNA test. So the pap smear if it's a conventional pap smear or the pap smear wherein a slide will be used, it's done every year. Now, if the pap smear is the liquid-based pap smear wherein the doctor will get a brush and then dip the brush inside the bottle, the pap smear may be done even every 3 years. If a high-risk HPV DNA test is done and the result is negative, what's good about this is it can be repeated after 5 years. So you don't have to go to your gynecologist every year if your high-risk HPV DNA test is negative. So why is this HPV DNA test so important? Because now we have realized that HPV is the reason for 99% of cervical cancers. It can also lead to many other cancers such as vaginal cancer, vulvar cancer, penile cancer, anal cancer, and even head and neck cancers. And HPV is common. Actually, 80% of women can have HPV in their lifetime. But 10% of these women may develop high-risk HPV, which may later on lead to cervical cancer years after the infection. So if we test these women for high-risk HPV, then we will know which women need further monitoring in case they are positive for high-risk HPV. In that way, we can really monitor those women who are at high risk and treat them even before cervical cancer arises. Next slide. So HPV, no? HPV can be actually 4 out of 5 women can have HPV in their lifetime. So it's very, very common. So what is the best way to prevent HPV infection? Because this is a skin-to-skin genital contact. No? It can be transmitted through skin-to-skin genital contact. So, you know, how do you prevent HPV? Aside from not having sex in your whole lifetime, which can be quite restrictive, you can have the HPV vaccine. Because the very good HPV vaccine now, the nanovalent vaccine, prevents 90% of HPV cancers. And HPV vaccine can prevent at least 6 types of cancers, even the head and neck cancer. And as I mentioned, the cervical cancer. Cervical cancer is the second most common cancer among women in the Philippines. Now, HPV can be prevented through vaccination. So girls and boys can get the HPV vaccine as early as 9 years of age. So if the child is less than 15 years of age, only 2 doses of the HPV vaccine are needed. Now, if the child is 15 years of age or older, then 3 doses are needed for protection. So I'm sorry that I segued into HPV and HPV vaccine. This is not a common cause of abnormal vaginal discharge, but we have been seeing cases of abnormal vaginal discharge that are actually caused by HPV infection in the cervix. Next slide, please. Next slide. Okay. So once your doctor performs the history, does the physical examination, and does all the laboratory tests, that doctor will evaluate, do you have vaginitis or a cervicitis? Do you have an infection or not? No? So in case that you do have an infection, there are many treatment options that are available. Depending on the kind of infection that is seen, your gynecologist might either prescribe a vaginal cream, a vaginal suppository, or oral tablets or capsules na antibiotics. No? So I will not name any specific brand or kind of medication because there are so many kinds that are available. So it will depend on what the diagnosis is. It is better to have a specific diagnosis so that the treatment is also targeted. Next slide. So this is my last slide. In case that your gynecologist will prescribe a vaginal suppository, do not be afraid. As was mentioned by Dr. Miravales, the vagina is a canal, no? It will not go anywhere except the vagina. It will not migrate to inside the uterus. The suppository will not go inside your abdomen. In case you are pregnant, there are some suppositories that are safe to use even during pregnancy. The suppository will not go to your baby. So your gynecologist knows which one is safe for you. And if you're pregnant, which one is safe even if you're pregnant. So sometimes if it's your first time to use a vaginal suppository, you may not be very comfortable. So how will you do this? Some suppositories can melt easily, especially in a tropical country in the Philippines. So if this suppository is the type that melts, it's better to keep it first in the refrigerator. And then usually we advise inserting the suppository at bedtime before sleeping, after urinating. It's important to wash your hands with soap and water first because you will be using your fingers to insert the suppository to prevent also infection from or bacteria from entering the vagina. And then gently remove the suppository from the blister pack and hold it with your fingers at the base. Now, if the suppository is dry or difficult to insert, you can moisten it with water or put a little bit of lubricant to make the suppository glide easier into the vagina. And then you can either raise one leg up, a chair or a toilet seat, and gently insert with your finger until the tip, until you can insert the suppository as deep as you can inside the vagina. Or you can lie down and separate your knees and also gently insert the suppository. Once you're sleeping, it will melt there, and when you wake up, probably there will be a little more discharge than usual, and that is normal. So I hope that I was able to allay your fears. Thank you so much for this talk.
Thank you so much, Dr. Patricia Ko, for that very interesting lecture. I know our viewers are already formulating questions in their minds, but we have one last industry-sponsored lecture to go. We'd like to call in Dr. Anafe Orbigosa Gloria again to the virtual floor. She will be discussing to us about vaginitis. And this lay forum would not be possible if not for our industry partner, Celtrion, who will then present an AVP after Dr. Gloria's lecture. Thank you.
Thank you so much, Carla. So now let me go through the lecture on vaginitis. Next slide, please. Vaginitis is an inflammation of the vagina. About 1 in every 3 women will suffer from vaginitis at some point in her life. It affects women of all ages, but it is most common during the reproductive years. It is often caused by infections, but sometimes it can be linked to more serious diseases. Next slide. The most common vaginal infections are the following: bacterial vaginosis, trichomoniasis, and vaginal yeast infection. Next slide. Although those are the most common vaginal infection, other causes of vaginitis are the following: sexually transmitted diseases, allergic reactions, and sometimes irritations from hygienic products. Next slide. Allergic symptoms can be caused by spermicides, vaginal hygiene products, like I mentioned, sometimes the detergents and the fabric softeners used in cleaning your underwears. And we also would like to mention about inflammation of the cervix. The cervix is the opening to the womb. There could be an inflammation which can cause also abnormal vaginal discharge. But of course, your healthcare providers can tell them apart if your vaginal discharge has infection or is abnormal by doing certain laboratory tests. Next slide. The most common symptoms of vaginitis are burning and itching outside of the vagina, or what we call the vulva. Sometimes the vulva may become red and swollen, but other times there might not be no change in the appearance at all. And sometimes the vaginal discharge may be white and lumpy. Next slide. Again, to diagnose a vaginitis, the doctor will take a sample of your vaginal discharge, like extensively mentioned by Dr. Patko, and sometimes they will examine this under the microscope in their clinic or send it to the laboratory. Next slide. So what are the causes of your vaginitis? Vaginitis is typically caused by a change in the balance between the yeast and bacteria in the vagina. The imbalance causes inflammation of the lining of the vagina, resulting in what we call a condition vaginitis. No? So several factors can change the balance in the vagina, which are the following. When you recently use antibiotics, when you are douching or cleaning very high or deep in your vagina with vaginal wash, or sometimes there are also specific douches that we can buy in the market. The use of spermicides, when there are changes in the hormones, especially during pregnancy, if you are breastfeeding, and then of course, if you are already in the menopause. The presence of infection and a new sexual partner or a more frequent sexual intercourse. So all these factors might cause more occurrence of vaginitis. Next slide. So what treatment do we give in cases a woman has vaginitis? It can be in a form of a pill, which you take orally, a cream or a gel, or a suppository that is applied or inserted inside the vagina. Next slide. Polycresulen is one of the most commonly and proven effective treatment for vaginitis, and these are the mechanism of action of polycresulen, which are mutually interconnected. One, it has antimicrobial action on bacteria, fungi, and protozoa. It has a broad antimicrobial action spectrum, which includes coverage on gram-negative and gram-positive, as well as certain fungi. It destroys the pathogenic germs of the vagina, like the bacteria, the trichomonas, and the fungi, but enhances the growth of your lactobacillus or your good bacteria responsible for maintaining the physiologic acidity of the vagina. The selective denaturation of the necrotic tissue and columnar epithelium. The process of healing is thereby stimulated and reepithelialization is promoted. The selective effect on dead or pathologic altered tissue, it also produces coagulation with subsequent elimination of the pathologic tissue, but it does not affect the healthy squamous epithelium. It has a hemostatic action by coagulation of blood protein and strong vasoconstriction of your small caliber blood vessels, and the potent astringent and hemostatic property would quickly decrease the subjective complaints of most patients like pruritus, vaginal discharge, of course. Next slide. So again, your polycresulen is a topical antiseptic. It is a condensation product of your methacrylsol sulfonic acid and methanol. Next slide. So again, our polycresulen has hemostatic activity by causing coagulation of your blood proteins and promotes the contraction of the muscular fibers of the blood vessels of small caliber. Your polycresolene promotes selective chemical debridement because it is an anion. It has the ability to interact only with the phospholipid molecules of the plasma membranes of the vitalized cells, which commonly had lost its original electric charge. And this contact provides the denaturation of cellular protein, facilitating their removal. Its acidity, together with the coagulating properties, give polycresolene antimicrobial activity against the common infection, which are Staphylococcus species, Streptococcus species, and Candida albicans. Next slide. So what about the use of polycresolene during pregnancy and breastfeeding? It may be used during this special condition only if strictly indicated. There had not been any studies of the risk associated with use during pregnancy in humans or even during breastfeeding, but animal studies have not yielded any evidence of fetal malformation. It is not known whether the active substance passes into the milk, so that, again, its use during pregnancy and breastfeeding is only restricted. And I think that's the last of my slide. Thank you so much for your kind attention. Back to you, Carla.
Thank you very much, Dr. Gloria. I think we've already heard so much about infections this afternoon. Now we'd like to introduce you to the company, Celtrion, that helped make this lay forum possible. We'd like to call on Mr. Marvin Cruz, the product specialist, Celtrion, the makers of polycresolene albuterol.
Thank you so much, Dr. Allow me to present this short video for the company. So short lang to, 4 minutes po.
Advanced and innovative therapeutics within everyone's reach. Celtrion Healthcare. In a hectic world, many people get lost in their busy lives, often overlooking the smaller but important things. They can lose sight of others, those in need of our help. Celtrion Healthcare started with a belief that the world could be a better place if people showed more warmth and offered a helping hand to those in need. At Celtrion Healthcare, we appreciate and never lose sight of the people around us. We are committed to putting patients first and believe that everyone deserves access to the treatments they require. By specializing in marketing and distribution of pharmaceutical products, Celtrion Healthcare has not only conducted medical and marketing activities to educate and deliver accurate information to healthcare professionals and patients, but have also thoroughly managed the distribution process to maintain the best quality from dispatch of medicinal products to administration on patients. Moreover, Celtrion Healthcare operates a rigorous pharmacovigilance system because safety of patients is the #1 priority for us. Biological agents account for a very large portion of approximately 20% of the total pharmaceutical market and 80% of the top 10 pharmaceutical products. Biologics are expected to continue to lead the growth of the global pharmaceutical market. With this prospect, the future of Celtrion Healthcare is even brighter than ever. Globally, Celtrion Healthcare has established a vast distribution network of partners and experts in more than 120 countries who have in-depth knowledge and experience in their local markets. Celltrion Healthcare establishes global marketing strategies for Remsima, the world's first monoclonal antibody biosimilar, Truxima, and Herzuma, and executes marketing activities that are optimized to each country with our global partners. The attention that started as simple curiosity on the world's first monoclonal antibody biosimilar developer has now changed to a stature standing side by side with leaders of the global pharmaceutical industry. And Celltrion Healthcare attracts attention from the medical community around the world whenever new clinical results are released. Celltrion Healthcare's medical and marketing activities are not just restricted to physicians. Celltrion Healthcare not only educates pharmacists, nurses, and patient advocacy groups, but has also persuaded government and insurance bodies to change policies in favor of biosimilars by proving that patient accessibility can be improved with the financial advantages of biosimilars. The NorSwitch study voluntarily conducted by the Norwegian government is a prime example. Celltrion Healthcare is strengthening its portfolio not only on new biosimilars, but also on chemical and new antibody drugs that surpass biobetters, and will expand its business area through mergers, acquisitions, and joint ventures. At Celltrion Healthcare, we are heading a new era in biologic therapy. We are committed to delivering affordable, high-quality, advanced therapeutics to patients and those who care for them. Celltrion Healthcare will evolve endlessly to ensure that necessary treatments will be available to all patients.
Again, I would like to thank our partners for OB Department of Makati Medical Center for allowing us to sponsor the last day forum of the year 2022. Again, thank you po. As well, we'd like to thank the OB Department Chair, Dr. Mercy Biduyang as well. Kung nandito si Doktora. Doktora, thank you po. And also our new speaker for just included in our speakers pool for colic resilient, Dr. Anape Gloria. She just came on board last October as part of our speakers pool for colic resilient albutil. And yan, Celltrion is a Korean-based company, and during the pandemic, November 2020, when they acquired 18 products from Takeda Pharmaceuticals, one of which is the anti-infective albutil, our albutil colic resilient albutil suppository. And before they acquired 18 products from Takeda, they specialized on biosimilars, specializing on biosimilars, including yung for HER2 positive breast CA patients as trastuzumab. So, but right now, since they acquired 18 products from Takeda, including albutil, so we will handle the sales and marketing of this anti-infective suppository for your patients with cervicitis and vaginitis. For the availability of albutil, again, we are available in Mercury, Southstar, and Watsons. And just recently po, available na rin kami in MedExpress. So for your patients' convenience, at least mas mabilis na po nilang ma-acquire si albutil. Not unlike before na talagang yun ang concern, mahirap daw hanapin. So again, on behalf of our company, Celltrion Healthcare, I would like to thank the OB Department of Makati Medical Center for allowing us to sponsor the last day forum of this year, 2022. Thank you.
Thank you so much, Marvin. Just to let you know, we've been using albutil for the longest time, actually, since we were residents, and I guess even the residents before us. A few years back lang naman. Not too long ago.
Thank you.
Okay, thank you, Celltrion. Thank you, Marvin, and thank you, albutil. Now we're going to move on to the next interesting round of this lay forum. Please stay tuned. We want this to be a light, a light discussion, and you can really just ask your questions. You can unmute your mics, or you can just type in your questions in the chat box. Now, to start off, I guess our audience is still shy. So you can really just message here or message us privately, and I'll ask the questions for you if you like. Okay. We did get a couple of questions before the lay forum. So to start off, I'm going to throw the question to a particular speaker, but all of our three speakers can actually answer. No? So for Dr. Tina, again, just to recap, what color and odor of vaginal discharge is considered abnormal?
The normal color of the vaginal discharge is usually white and creamy. Sometimes it's gooey, sometimes it's sticky. It depends on it depends on the menstrual cycle, no? So if it's abnormal, like it's yellowish, it has an unpleasant odor, then it can be abnormal. Okay. How about you, Anna? What can you
I
consider as
think-
an abnormal discharge?
So for the odor, when it smells like fish or unpleasant, then definitely it's not normal. And of course, if it's becoming more intense after your intimacy, then you have to really take note and see your doctor the following day.
How about Dr. Pat? You want to add to that?
Well, some women, they really have more discharge than other women. It doesn't necessarily mean that you have an infection or there's something wrong with you. But if it suddenly changed, as was mentioned by Dr. Gloria and Dr. Miravales, if there was a change, sudden change, then it's better to consult your gynecologist.
Okay, thank you for that. Now, to follow up, should a woman have herself checked even if she doesn't have any abnormal vaginal discharge? Tina, Dr. Miravales.
First of all, the woman should be checked at least once a year. No, we have to get the pap smear, as previously mentioned in the lectures of Dr. Ana Gloria and Dr. Patco, no, for cervical cancer screening. Okay.
Okay, thank you. What about for Dr. Gloria? Are there certain factors such as food or activities that can contribute to a woman having an abnormal vaginal discharge?
As for the kind of food that you eat, maybe whatever you eat, you also excrete it out. So if you want to be, I believe so that you should be eating more natural kind of food to ensure that whatever you excrete is also not smelling too strongly. But then again, it might not really contribute to that. What was the other question? Activity?
Yes, activities like sports maybe, or gym, or even sexual.
Well,
intimacy.
definitely if you perspire and you just go to just had your workout, you really have to change your underwear because the sweating in itself might add up to more stimulation of the discharge, and of course the sweat in itself would have a lot of other secretions as well as coming from your sweat glands, diba? So please do wash after or change your underwear after a workout because the sweat would contribute to the bad smell in your vaginal discharge. What about you, Pat?
Okay, thank you.
Yeah, that's true. Working out, especially, we noticed that if you wear a tight-fitting lycra sweatpants, yeah, because especially in the Philippines where it's very hot and humid, and then you work out and then you're wearing lycra pants, there can be a bad odor after. So it's better to change after working out. Also, some women after swimming, some women are very sensitive, others are not. So those women who are very sensitive and then they go swimming either in the pool or in the beach and then they don't change after they bathe, they're wearing their wet swimsuit for a long time, they can be prone to fungal infection. Not all, but there are some women who are prone to fungal infection. Some women are very prone to fungal infection when they eat sweets, they like to eat mga desserts. They're very susceptible to fungal infection. So if you're the type who are susceptible, then you can, as you mentioned, eat more healthy food and avoid too much sweets.
Dr. Castro, I think there's an important question there in the chat box.
Yes, I will read the question after we go through the pre-lay forum
Lecture.
question.
Okay.
Oh, I'll get to the questions, the other questions. Thank you. So corollary to that, no? So we've talked about the infections. So how now do we try to keep our vaginal health healthy?
I think just by eating the
Are there, sorry,
food,
just
no?
to follow up, are there supplements that can be taken? Like vitamins for the, for the intimate parts. Is there a truth to that?
Let's ask Pat.
Dr. Ko.
Dr. Ko. Dr. Ko is an infectious disease specialist in OBGYN. So
There's no special food or there's no vitamin, that will promote a healthy vagina. So I think it's a healthy lifestyle. Basic hygiene, healthy diet, avoid very sweet food or very processed food, and then probably mutual monogamy. If you're not sure about your partner, then wear a condom. Yeah.
Wear
So
barrier.
when do we just give the probiotics? But there are probiotics in the market.
So there are many probiotics now in the market. Because especially after you take antibiotic, the good bacteria can also die, and then you can be prone to bacterial vaginosis or vulvovaginal candidiasis. So supposedly, it can replenish the good bacteria, the lactobacilli in the vagina. So, but the evidence is still weak, no? We still need more studies. So anecdotally, there are women who say that it helps maintain the normal vaginal flora, they feel better, but the scientific evidence is still, we're still in the process of studying the efficacy of probiotics.
Thanks, Dr. Pat. Now, one more question. We've talked about the basic or the common vaginal infections, but what is a specific kind of discharge that can get you worried? Na parang, I think I really need to go to my OBGYN now. Is there a particular vaginal discharge that kind of makes you worried, kind of makes you think it's not the typical? Dr. Patko, please answer.
So, of course, if you feel na it's really purulent, it really smells very bad, for sure, no? You really have to have a checkup. If there's an unusual fishy odor, it can be normal, but it can also be a sign of infection. What else? If you have discharge that is blood tinged after sexual contact or in between your periods, it's better to consult a doctor. Or if the discharge is very yellow or it's really green, or it's very thick and clumpy and there's a burning sensation, better have a checkup. So even if eventually your doctor says that everything is normal, at least you consulted the doctor and then you were given peace of mind that it's not unusual, but it's still better to have a consultation.
Agree. And actually, even if you don't have any abnormal discharge, a regular checkup, a regular pap smear with your OBGYN would really ensure vaginal health as well, and as well as gynecologic health. Now to read your question from the chat box, Miss Phoebe Queck is asking, Number one, I guess I'll throw each question for each speaker. For Dr. Miravalles, how shaven should the vagina be prior to the physical examination? Would trimming suffice, especially for those afraid to get waxed? Or do you even need to do this?
Actually, you don't need to have it shaven, no? Even if with hairs, we can examine you because we don't usually, for the discharge, we don't usually check the outside, but we check in the vaginal canal. No? But of course, we have to check also the outside if there are any other abnormalities. Okay.
Thank you, Dr.
Are you also doing that? I don't require patients to shave or to get waxed, no?
Okay. Next question is for Dr. Gloria. Are there different types of lubricants? And if so, which one is ideal for suppository insertion?
If it's just for suppository insertion, then maybe it's best that you just use water before inserting the suppository. But for more convenience during sexual intercourse, then it's best to use water-based lubricants.
Okay. Agree, Dr. Gloria. For Dr. Patko, will the chances of someone contracting HPV lessen if even one of the partners is already vaccinated?
Yes, of course, no? So with the vaccine, because there's hundreds of strains of HPV, but with the vaccine, that person is protected against around 9 strains of HPV. And these strains that are present in the vaccine are those that are potentially cancerous. So if your partner is vaccinated against HPV, then that partner most likely does not have the cancerous kind of HPV. And this will protect not only the vaccinated person, but also the sexual partner, because there will be less chance of transmitting the carcinogenic form of HPV. So that's why we don't encourage only women to be vaccinated against HPV. Actually, it's important also for the men to be vaccinated so they will protect their partners. And also, now that we know that the HPV vaccine even protects against head and neck cancer, which is also common among men, it's important for men also to be vaccinated.
I have a follow-up question to that, Dr. Pat. Do you get HPV just by sexual intimacy, or can what they call, dry sex or humping? Can you already get HPV just from skin-to-skin contact?
Yes, actually, that's a very interesting question. No? So the transmission of HPV is through skin-to-skin genital contact. So just, as you mentioned, dry humping or one genital touching the other genital can already transmit the HPV. So there doesn't have to be any penetration involved. No? So that's why it's very prevalent, it's common, because it's very easily transmitted.
Okay, nag-iba yung view natin.
I just
nagulat ako.
Guys, okay. Naging panel. It's like we're in a legit panel discussion here. And really, ladies and or gentlemen viewers, you can just really ask your questions. It's meant to be a very light discussion, okay? This question is, anyone can answer this question. I think this is for women who do shave or who do get their hair taken out, no? Is it better to wax the pubic part? Or is there another preferable way for your hair to be removed in the pubic part or elsewhere, I guess? So do you
Better way?
I think it
you
really
take it all
depends on your
out? Is it
preference.
better to take it all out or just leave some hair?
What's the
What do you
function of
think?
the hair in the pubic area ba?
Dr. Miravalles, please answer that question. Why do you have pubic hair?
Okay, you can take out the pubic hair with any forms, no? One is waxing, one is trimming, or you can also have the laser. I think the newest one is the diode. Before it's IPL, but it's a little bit painful, no? Diode is less painful. Parang there's a heat involved in it. I think you don't really need the hair. Let's ask Pat or Anna. Do we need the hair in the pubic part?
Well, since we are already all of us, I presume, would wear underwear and not go commando most of the time. So the presence of the hair is ano ba yan, nag-iba uli? The presence of the hair down there is, I think, a preference of the woman. For us gynecologists, it wouldn't matter, but as your personal preference on how you want it taken out, like through shaving, waxing, I think also it depends on what you prefer and what you can tolerate.
I'm sorry.
Soya, strawberry.
Maybe kindly ask you to mute your mics, please. Dr. Gloria, please finish your answer. Thank you.
Sorry, I said as to how you want it taken out, the hair, whether by shaving, by waxing, or the use of IPL or laser, would really depends on you as well. Kasi those procedures are also quite pricey and sometimes would also be painful. So whatever you think or whichever, most of them are also harmless, I believe.
Ang tawag daw doon, ganda.
Yeah, tease ganda. Yeah. If you want your tease ganda, that's fine as well. But if you want it like with the hair, still with the hair and be traditional, that's also fine.
Okay. So yeah, thank you for that very interesting and fun. I think it's a fun discussion considering this used to be a taboo
Topic.
and even to say the word, no, it's not even allowed a few years ago. So this is as Dr. Pat would call it, this is a pioneer. I mean, what did you say? What was the term used? Breakthrough.
Unprecedented.
Unprecedented and a breakthrough lay forum. So I think that is the last question we will answer. Thank you very much for being with us tonight. Maybe call on Dr. Miravalles to present the certificates for our speakers.
Okay. Dr. Viduya is supposed to be here. She was here a while ago. So in behalf of Dr. Mercedes Viduya, our chairman, and the residency training officer, Dr. Georgian Lazaro, she's caught up in her operative procedure. So she's supposed to present the certificate. So being the lay forum coordinator, I'll just present na lang the certificates, no? Can you show the certificates, Mikey? Because I'm just gonna read on it. So certificate of appreciation is given to Dr. Carla Victoria Espina Castro in recognition for sharing her valuable contribution as moderator in the Take Charge of Your Vaginal Discharge Lay Forum, given this 5th of December, 2022 at the Makati Medical Center, Makati City, signed by Dr. Mercedes Viduya, Dr. Georgian Marie Lazaro, and yours truly. Next. Okay. This certificate of appreciation is awarded to me, Dr. Maria Christine Mirabal, Dr. Ana Fe Gloria. Can you show the next Dr. Ana Fe Gloria and Dr. Patricia Florestin Co, in recognition for sharing their valuable knowledge as the panel discussants in the Take Charge of Your Vaginal Discharge Lay Forum, given this 5th of December 2022 at the Makati Medical Center, Makati City, signed by Dr. Mercedes Viduya, Dr. Georgian Marie Lazaro, and yours truly. Thank you everyone for participating. Thank you for helping me with this lay forum, the three of you.
Thank you to our excellent speakers, our dear viewers for being with us, to Celtrion for making this Lay Forum possible. We wish you all a healthy and safe holiday season. Good night, everyone.
Merry
Photo op
Christmas.
muna tayo.
Ay, photo
Photo
op.
op tayo.
Maybe ask
Nasaan na si-
you all to stay for just
You will
for
request everyone to turn on your camera, your video cam.
Yan, tayo.
Apat lang. Hindi, yan.
all the rest.
Remove the pin, remove our pins so that we can, we can mingle with the
Hello to all
others.
our consultants and dear patients, friends, colleagues.
Got it.
Okay.
Who's
Please,
gonna take the picture?
um,
Okay. Please say 1, 2, 3.
dapat pala imbis na ganon.
Vagina.
1, 2, 3. One, two, three.
Tuwan-tuwa si Mikey, oh.
Mikey,
Okay na po,
pinaikot-ikot mo
Doc.
kami sa stage.
Thank you. Thank you very much. and
Wait,
good night,
pahingi ako.
everyone.
Mikey, picturean mo kaming apat. Natutuwa ako dun sa stage. Picturean mo kaming apat.
Are you done with the gallery na? Are you done?
Are we done? Are we done, Mikey?
Thank you to all our
Yes po, Doc.
attendees.
Okay na po.
Okay.
Thank you, everyone.
Everyone.
Mikey, picturean mo kaming apat.
Yes, sa stage.
Yan. Ayan.
Mikey, doon ka sa gitna.
Ay, ikaw sa gitna.
Stay in the middle. Ikaw sa middle.
Wait, Doc, I'll change it. Wait.
Ikaw ba yan? It's so funny.
Yes, Doc. Sorry.
Nawawala ako kanina eh. Pag nag-iiba yung ano natin. Yan.
Okay.
Alisin ko muna yan. Mag-picture ba tayo dito?
Okay po. Next
Okay.
scenario.
Si Mau
Next
naman
scenario.
yung nasa gitna.
Ikaw
Mau,
naman.
ikaw naman yung nasa gitna.
Wait, Doc, in the boardroom, Doc. Wait.
Nakakatuwa yung panel.
Ayan. Nagulat din ako eh. Sabi ko,
Si Mau wala, oh. Ayan, andyan ka din, Mau.
Ayan. O, Mau.
Ayan, para magka-classmates tayo. Ayan.
So cute. Ang dark mo, Mau.
Wala kang light source. Ako siya natawa. Di ba nakakatuwa?
Maganda to sa FB stories. Take charge of your vaginal discharge.
Si Angel wala dito. Wala siyang upuan.
I'm
Hi, Angel. Wala
wait, Doc.
Dagdag natin si Angel ko.
Doon sa doon sa parang naka-stage, parang nasa Senado, yung may ganon. Baka kasya si Angel doon.
naglaro mga bata.
Oh, na.
Dito ko.
Si Angel, wala.
Wait.
Hindi siya kasya dito, doon sa sa stage.
Wait, Doc, changing it. Wait.
Sorry.
I forgot to announce. We'd like to thank Dr. Gloria for waiving her professional fee.
Yay!
Appreciate you, Dr. Gloria.
Ayan na, ayan. Ayan, kasama si Angel, the extended team. Na photo na. Tapos share mo sa amin, ha? Share mo dito so that we can share it in our group.
Okay, Doc. One more, Doc. Wait.
V is for vagina.
V? Hindi si V ng BTS, ha? Baka si V.
Vagina.
Okay, Doc.
Natuwa si Tina. Wala nang adcon bukas.
Ito
Joke.
dami yun.
Natuwa si Mikey, Doc.
Okay. Let's call it a day na.
Please, thank
Okay.
you. Galing, galing.
Thank
Thank
you.
you.
Thank you, everyone.
Thank you, Mikey.
We're gonna
Bye-bye.
miss you, Mau,
Thank you,
next
Doc.
year.
Michelle. Thank you, ladies.
We're gonna miss Mau next year. Lagi kong kinukulit.
Iba naman.
Iba naman. Si Mikey naman, tsaka si Angel ulit. Kukulitin ko.
Retain na lang natin.
Okay.
Okay, bye-bye. See you
Bye.
Thank
tomorrow.
you. Bye-bye. See you.
Bye-bye.
Good night. Thank you.
Good
Thank
night.
you.
Thanks.